basic, simple, safe way of thinking about and managing chronic pain. Questions? What?
Yeah, question about methadone.
Methadone.
That's used for pain, and also it's used, we have methadone clinics.
Methadone
Clinics
clinic, yes.
where people with addiction go
To
to.
addiction to heroin.
Yeah, so is methadone addictive?
Yes, yes it is. All of these are addictive.
So what's the
All of
difference
these are
between
addictive.
methadone and
Yeah,
then?
methadone has to be administered one pill at a time in an environment in which the patient is accessible. You can't give methadone and say, come back and see me tomorrow. You have to have it where you can treat them. Usually it's done on an inpatient basis. This is what a lot of the clinics do to try to get people off the drug. It needs to be effective. It's a good drug, but it's a dangerous drug.
Why is it better than heroin?
Well, you know, I don't have heroin listed here. I don't think heroin should be used as an analgesic drug. Jenny?
I'm just beginning to put a couple of things together. I didn't before, but I realized that when I was examining shortly after I had that fall, my blood pressure had gone up about 40, 45
Points.
points. And would that be caused by the pain from the fall?
Yes, yes it would.
Okay.
The more acute pain, the more you would, the pressure would go. As long as you were aware of it. Of course, if you became unconscious or comatose, you wouldn't have it, that wouldn't occur.
It just puzzled me at the time,
Yeah.
but now it's suddenly gone. So
Yeah, it's an autonomic response, an involuntary response over which you have no control.
Address patches, would you, Doctor?
Pardon?
Address patches?
The only patch that I would use is the fentanyl. What kind of patch are you talking
Ben Gay has a patch.
about? Shit.
Is it any good?
I don't have no idea. I've never used Mid-Gay, don't know anything about it. I don't know. I don't know.
Doesn't that come under the heading of adjuvant
Yeah,
treatment?
I think that would come under adjuvant treatment. It would also come under,
Johnson and Johnson is touting it.
of course, alternative medicines.
I see.
I put that in the same category as herbs and other kinds of things.
They tried all, doctors, Kaiser doctors tried all different kinds of things for my pain, and none of them did any good, including I had a pain patch which was morphine,
Yeah.
and not even that did much of any good. I suppose, is it possible that some people just don't
Don't respond? Yeah, people are all different, and it would depend upon, basically it would depend upon what is the cause of the pain. And if the pain is that great, then nothing's going to relieve it. But you start off with these and you try one after the other. The response of the patient is not, you can't really tell what the response of the patient is going to be until you try it. Everything is trial and error. And the same thing with the dose. Start off small, you build up trial, and you see. But the problem with chronic pain is it's easy to make a person addicted to this stuff. Corey?
I share a common problem with a lot of people. I appear to be allergic to codeine-based drugs. And how can you tell? Is oxycodone, for instance,
I would, yeah.
a codone derivative?
Yeah, it is, but
Codeine derivative.
I would try that.
I would not try it.
No, I wouldn't try it. Now, when you say I'm allergic to codeine,
I'm allergic to codeine.
In-
And I said,
in
is
what?
oxycodone one of the codeine derivatives?
yeah, but
So that I can't take it.
well, it depends now. What are the symptoms of the so-called allergy?
I throw up.
That's a side effect. That's not an allergy.
Very shortly thereafter.
It's a side effect.
Okay, I
Gastric-
have a strong side effect to codeine.
Right. Gastric irritation and nausea and vomiting are side effects of all these drugs. But that is not allergy.
Okay, all of these are prescription drugs in the United
Every-
States.
everyone.
Yeah. Codeine was available without prescription in England, and I used to use that regularly for pain relief, and it's very effective until I started getting sick from it.
Yeah, well, it can make you sick.
So Vicodin and all of those are out there. Yeah.
Vicodin, well, not necessarily. It's worth a try to see. And maybe the nausea and vomiting is because the dose was too high or the dose was too frequent. So that's the reason the doctor says, this is what I think you have, this is what I think you should do, let's try it. So you try, I want to see you in a week, I want to see you in 2 weeks.
Yeah.
And you go back in a week and say, I didn't do a damn thing. Or I did this or did that. And you go from there. And all medications are like that. I don't care if it's antibiotics, anticonvulsants, whatever you're talking about. You start slow, you work it up. Every drug has side effects. Not very many, and most of the time, they're not allergies, although they can be.
You said you wouldn't recommend Celebrex. I wondered why.
The too many side effects, the very serious side effects, and a lot of cardiovascular events, strokes, and heart attacks. And if you take a group of people on Celebrex and a similar group of people not, this group gets much, much more. That's like Vioxx. Vioxx went off the market because Vioxx and Celebrex are like this,
Yeah.
very close. Jim?
Weather, atmospheric pressure, has a
Absolutely.
great deal to do with arthritic pain.
Yes, yes it does. Don't ask me why. I have no explanation for that, except it's a fact.
It's been very bad this
It should be bad yesterday and today.
Yeah.
We're having a low.
Yeah.
Yeah, I don't know why.
Because it's the pressure or the humidity?
No, we think it's a barometric pressure. I don't know.
It can go up, my wife hurts. It can go down, my wife hurts.
Your wife hurts all the time.
She does.
She does.
And she can't take her body doesn't assimilate the drugs the same way everybody else does.
Well, there's another way of administering these, and that's rectally, which isn't used much nowadays, but there are forms of these drugs that can be administered rectally that avoid the stomach altogether, but who wants to be sticking a suppository up there every 6 hours or so?
Yeah.
But it's a way. And that's why the patches are so popular, because you don't have to swallow the pills. Yeah. Jan?
What about bariatric treatment? You know, this talking about atmospheric pressure, there are these bariatric chambers that some people are using. Do they do anything?
No, they don't do a thing. The compression chambers are used principally for drownings and for bends, people who have to be brought up from depths of water and need super oxygen. If you pay $25,000, $50,000 for a tank, and that's what we call them, tanks, you want to use your tank. You don't want your tank standing idly by and not carrying its own load. So you put all kinds of stuff into the tank to see if you can help the person, but more likely to see if you can make a profit from the tank. They use this, the only use that I would see is chronic leg ulcers respond to a degree by this treatment. Strokes do not. There's no point in putting a stroke patient in a tank. It isn't going to do anything except make the tank money. There are very limited uses for those tanks, but because they have them, and because they have technicians who are on duty every day, they want to use them. So they think up all kinds of ways and reasons to use them.
Do they work for burns?
I don't know if they use them for burns or not. I don't think so, but I don't know for sure. Burns are a specialty unto themselves. And we had a very good unit in the San Fernando Valley, for burns. And it's usually in a county-wide, there'll be one hospital that specializes in burns. It's a very, very difficult, painful undertaking, burns.
You didn't say anything about chiropractors.
No, I didn't say anything about chiropractors. And I'm
They
not,
adjust your spine?
they will not adjust my spine. May adjust your spine, but not mine.
What's your...
I've covered this before. The only place that I can see a chiropractic use is in what is called facet problems. The vertebrae sit on two, like that. And if this one slips, or if you get something in between this facet, then chiropractic adjustment makes sense. Because you've got something squeezed between two bones. And so you open up those bones, the thing pops out, you're better. That's called facet disease. But again, the chiropractor's there, and he's been trained to do all kinds of things, and so he does them. But are they effective? And if they are effective, why are they effective? Are they effective because of what he did? Or are they effective because of what you think he did? I can't answer that question.
Does hot, dry weather improve arthritic stuff?
Supposedly so, yes.
I just feel glorious on a hot, dry day.
I feel glorious, but I've had 2 martinis.
Days are gone.
As we age,
Yes,
arthritis seems to get worse.
of course. Of course it is. Arthritis, just forget arthritis. Wear and tear. Wear and tear. Bone on bone. No pad, no cartilage in between. It's bone on bone. It's metal on metal. It's bone on metal. It's a shoulder that is shot. Take an x-ray, and instead of a nice round thing like that, it looks like a spear. It's
For some people, it's worse
of course,
than other people.
of course, it's worse. It's all a matter of degree. I just hope you guys who are walking 14,000 steps a day don't wear out your bones.
I think there's something to that. Since I've been in the stepping program, I've been hurting.
Well, so the others are doing extremely well.
I know.
Well,
I mean, you just have to find the happy medium.
you have to find a happy medium. I think exercise is just like everything else, moderation. You need it, but you don't need 14,000 steps.
People
I did. Well, they do. They're doing it
I know.
all the time.
Yeah, I have one comment. I think the medical profession are so afraid of people getting addicted when you give them the opiates.
Yes.
And I have an experience one time with my first wife. She had terrible cancer, all that. And the doctor didn't want to give her anything because she's going to get addicted.
No, that's
As long as what the hell difference does it make?
That's it.
So he finally gave her Brown's mixture and it worked great.
Yeah.
Now, it comes to people who are older, getting close to 90, they're not going to live so much longer.
Careful.
So are we? Yeah, you're not going to live to 120, but I mean, as you get age, why are you so concerned about being addicted when you get so much older? Because it's going to take time before you really get addicted.
Well, what you're saying is true. I made a distinction between chronic pain in cancer patients and chronic pain in non-cancer patients. In cancer patients, you give them whatever it takes to make them comfortable. It doesn't make any difference if they get addicted or not. You keep them comfortable. But if you have a condition like an osteoarthritic thing, You have no idea how long that patient's going to live, and you have no right to cause an additional problem
So when
that might be avoided.
so when you get to be 90, sorry.
We got 4 people being 100 this year.
So but it takes a long time to get addicted, doesn't it?
No, it does not. It does not. Depends on the dose and the frequency, and the individual. They're all different. They're all, you can't put everybody in the same box.
Yeah.
In fact, you can't put anybody in the same box. They're all different. And none of us can predict. You might say, I'm getting to be 90, I don't think they're going to be there much longer. You have no idea about that. And all I do is look around, look at we got 50 people over 90 and 4 are going to be 100. And I hope I'm one of these. Okay, all right, Jack.
Do we have less resistance to inflammation as we age?
Yes, I think you do. I think the immune system fails like every other system fails, and just like our memory fails, and our bone marrow that makes blood fails, everything goes down. And I think you may be more, possibly more. Can't say for sure. Each individual case is different.
If you have inflammation and apply ice, should you always then follow that with a
If you have acute injury, I twisted my ankle and sprained my ankle, put ice on it for maybe 2-3 days, and then put heat on it. The heat helps the circulation to heal, but the ice keeps the swelling from causing more problems. So you do that. Acute things need ice.
and heat.
Chronic things, I use heat.
Oh, I see.
General, and as a general statement. As a general statement. Okay.
One other question.
One more.
I've seen on television, Phil Mickelson says he has psoriatic
Yeah.
arthritis.
Yeah.
What is psoriatic
Okay.
arthritis?
Some people, not everybody, with psoriasis. Now, psoriasis is a thick, scaly, white, reddish patch on the skin,
My dad had.
generally on the knees, on the elbows, in the crease between your two gluteal muscles back there. You can get psoriasis. Some people, very small number, with psoriasis get a terrible kind of arthritis, worse than rheumatoid arthritis. Bad arthritis. But to go on the television with his reputation and his personality and tout this medication is, in my way of thinking, is wrong. And for you to pay, for anybody to pay attention to that is also wrong. You pay attention to what your doctor tells you to do, not what's on the damn television. And I just think that's awful. I cringe every time I see that, and I see it very often. Embro or something like that. Some damn thing.
You know, I was in the health claim business, and we had one man submit a claim for a box, a sun box, with
A tanning box?
it was like a coffin. He'd lay in it like the kids do now.
Tanning.
To cure his psoriasis.
Yes, the sun is very good for psoriasis, and regardless of what part of your body it is, they say get out and lay in the sun, even if you're nude.
We
Psoriasis.
questioned if it was an eligible expense under the terms of the policy.
No, I said them out. Tell them to go out to the beach. There's nude beaches all over.
Not in Chicago.
About your own backyard.
Well, then you got the neighbors.
What about medical marijuana?
Medical marijuana is the biggest crookery thing in the world. I said before, you can go to the doctor and say, I want a prescription for medical marijuana, plunk $50 down on the desk, and you got it. And there are doctors who do nothing but write these prescriptions all day long. And then you have medical marijuana, you got 15 places in a geographic area that could be served by one. Why? Because this is all...
Money machine.
Yeah, this is not right. This is not right. The number, and what does medical marijuana actually do? I don't know that they've proved that it really does anything, but what it possibly could do is make a person who has a problem feel better. But it doesn't do anything to the problem at all. It's a symptomatic, it would be a symptomatic thing. But most people who go to the medical marijuana dispensaries, when you actually investigate, there isn't anything wrong.
Well, Valium would do that.
Yeah, Valium requires a prescription too, but it doesn't cost you $50 to get it.
Yeah.
No, this is right. The only answer to that is to legalize it.
Take medication you can't take.
I don't like that. Okay.
Thank you very much. Thank you.